The next speaker is Dr. Eric Joseph, liquid injectable silicone, over 1,500 procedures.
Greetings, Dr. Eric Joseph from West Orange, New Jersey, and it is a great privilege to address this audience on my favorable experience with liquid injectable silicone in my facial plastic surgery solo private practice. There are many off-label applications for liquid injectable silicone, and unlike other fillers, the injection technique, the serial puncture microdroplet technique, is very important for achieving a desired result and for eliminating or minimizing complications. On the left is the great Dr. Alvin Blastold, my fellowship preceptor, mentor, friend, and he introduced me to the art of silicone nasal injections during my facial plastic surgery fellowship in 1998. And I subsequently refined my technique and started injecting all over the face after learning from Dr. Jay Barnett, dermatologic surgeon with over 45 years of experience and tens of thousands of cases, and he's also an AAFPRSF fellow. If you're interested in doing off-label, non-surgical facial rejuvenation with injectable silicone, there are 2 medical devices in the United States of America that are FDA approved for intraocular injection and tamponade of a displaced retina. The 1000 Centostoke product can be delivered through a 27-gauge half-inch needle and is the most practical. When evaluating a patient and determining the candidacy for silicone, the off-label application of an FDA-approved device is stressed, and the fact that several treatments are required for a desired result, and that there's a possibility of developing nodules, bumps, or overcorrection. Photography of patients are taken as though you're photographing before a facial plastic surgical procedure because you're using a permanent filler with permanent results. I mark my patients with betadine on the Q-tip, and a topical anesthetic ointment is applied for about 10 minutes. If you're going to start with trying liquid injectable silicone, I would suggest starting with plastic 1 cc Lorlock syringes filled to 0.6 of a cc and half-inch 27-gauge needles. The serial puncture microdroplet technique really has to do with, it's not a threading technique, it's a multiple puncture technique where anywhere between 1/100th of a cc and 1/10 of a cc is deposited per puncture. I'm going to say this a couple of times. If you want to eliminate wrinkles and you're injecting intradermally, we're dealing with 1/100th of a cc per deposit. If we're dealing with folds, grooves, and adding volume, these are subcutaneous injections, and the volume per puncture is between 0.25 of a cc and 1/10 of a cc. Injection intervals are monthly or longer, and you tell the patients to expect several treatments for a desired result. I routinely have patients come back in 1 to 2 weeks after the procedure for reassessment and photography. This patient is marked in the nasolabial folds, marionette grooves, and lips for treatment. I prefer using glass syringes because the plunger doesn't bend on injection. These syringes are filled to 0.6 of a cc, and you can see that there's half-inch 27-gauge needles on them, and the 3-ring control adds for additional precision while injecting. So I start at the bottom, so while injecting a marionette groove, the non-dominant hand is placed firmly against the patient's face to stretch the skin taut. And approximately 10 to 15 punctures are made along the groove with deposition of approximately 0.25 of a cc per puncture into the subcutaneous plane. And you can notice that the non-dominant hand also stabilizes the syringe for precise injection. The identical treatment is performed on the other side while the patient is holding firm pressure on the previously injected side. Again, 10 to 15 punctures, depositing 0.25 of a cc of silicone per puncture. And note the depth of the needle. This is a subcutaneous, not an intradermal injection. Also note the blanching that's starting to happen in the upper lip from the vasoconstrictor and the topical anesthetic. The nasolabial folds are injected identically, 10 to 15 punctures from the bottom to the top, 0.3 of a cc on the right, 0.3 of a cc on the left, And again, notice that this is a deep placement of silicone. When the lips are injected, the patient is placed in the semi-recumbent position, and the non-dominant hand is used to evert the lips since the vermilion only is injected. 3/10 of a cc is injected into the upper lip, 3/10 of a cc is injected into the lower lip through approximately 15 punctures on the top and 15 punctures on the bottom. And you can see immediately after the procedure there's no significant downtime or bruising. When we're talking about silicone nasal injections, this is probably the most relevant for this audience, especially if you're interested in rhinoplasty surgery. You can camouflage a small dorsal hump, increase the height of the dorsum, straighten a crooked nasal appearance, eliminate indentations, fill deepened supraalar creases, lower retracted nostrils, and improve basse and other rhinoplasty irregularities. This is a 16-year-old child with strong chin projection and obtuse nasolabial angle after repair of a small profile hump. This is an ethnic patient with a broad, flat nose who is requesting heightening of the nasal dorsum. This is a geriatric patient with a saddle nose deformity, and you can see nice correction. This is a post-traumatic crooked appearance in a patient with a non-obstructed airway, and you can see a markedly straighter appearance by injecting the right upper lateral cartilage area. This is one of my own rhinoplasty patients who developed a small indentation along the left osteotomy after that was apparent 3 months post-operatively that was filled. This patient with thin skin and firm cartilage has nearly all of the stigmata of rhinoplasty surgery, including over-resection, a crooked appearance, asymmetrical nasal basse, deepened supraalar creases, and nostril retraction. You can see on the oblique view that the dorsum has been filled, the appearance of the cartilaginous basse is improved, the infratip lobule is improved, the supraalar crease is filled, and this subtle nostril lowering. This is also seen on the profile view with a marked improvement in his appearance without revision rhinoplasty surgery. When injecting tear troughs or lower eyelid grooves, this is a delicate area, and the placement of silicone is superficial between the skin and orbicularis oculi muscle. In general, 1/10 to 3/10 of a cc of silicone is injected on each side, and this area is prone to bruise because of the thinness of the skin. But because of the thinness of the skin, it's a nearly painless procedure. This is a typical result of a 30-something-year-old woman requesting lower eyelid rejuvenation. This is a patient who presented to my office who was not interested in brow lift surgery, blepharoplasty surgery, and was also noted to have scleral show, lax lower eyelid tone, and in my view, a poor candidate for blepharoplasty surgery in my hands. So you can see how adding volume to the skeletonized inferior orbital rim dramatically improves the contour and the appearance without blepharoplasty surgery. This is improvement to the appearance of a prominent orbicularis roll in an Asian patient after having blepharoplasty surgery performed. When dealing with facial volume replacement, it's a subcutaneous deep injection where up to 1/10 of a cc of silicone is deposited per puncture. This is a patient with mid-facial HIV lipoatrophy several weeks after injection. And this is 7 years later, demonstrating the permanence of the product as well as the lack of migration when it is injected properly. This is a case of mid-facial injection of silicone and injection of silicone in the malar area. This provides for blending of the lower eyelid bags and mid-facial expansion for a youthening effect. When injecting skin wrinkles, again, it's an intradermal injection and we're dealing with hundredths of a cc per puncture. When we're dealing with folds, grooves, and adding volume, it's a subcutaneous injection, and the volume placed is between 25 hundredths of a cc and 1/10 of a cc. This is after injecting lower eyelid grooves, nasolabial folds, and lips. This is following an injection to the lips, and as was previously described, silicone is well suited for a